Hi! This video was created by a group of occupational therapy students at Texas Tech University Health Sciences Center. Today, we are going to talk about incontinence training, which can benefit all women, but in particular, women who are pregnant or postpartum. So what is incontinence? Incontinence is accidental or loss of voluntary control of bowel, which is referred to as anal incontinence, and bladder, which is called urinary incontinence. This happens when the brain is not alerting the bladder or when the muscles of the bladder do not squeeze strongly enough. It can also be a combination of both. As you can see by the statistics on this page, more women than you would expect experience urinary incontinence, and women experience urinary incontinence twice as often as men. There are 6 different types of urinary incontinence in women. We will address this list during the presentation. The first type of incontinence we will address is stress incontinence. This type results from movements that put pressure on the bladder, which can include coughing, sneezing, laughing, physical activity, or anything else that may put extreme or slight pressure on your bladder. Stress incontinence can also happen when your pelvic floor muscles are weaker than normal. This causes your bladder to move farther down into your pelvis and makes it difficult for you to completely go to the bathroom whenever you need to go. The next kind of incontinence is urgency incontinence. This happens whenever you have to go to the bathroom really bad. It's usually due to involuntary bladder contractions, which simply means that your muscles contract in your bladder without you making them, or abnormal nerve signals. This can be triggered by drinking small amounts of water, hearing running water, being cold, or can even be worsened by anxiety or worry. Stress incontinence and urgency incontinence are the 2 most common types, but there are other types of incontinence, as you see here: mixed, functional, transient, and overflow. Everyone is at risk for incontinence, males and females, and it typically happens when you're older. Some risk factors of incontinence are pregnancy, younger women who have had children, menopause, obesity, urinary tract infections, constipation, specific types of surgery, reduced mobility preventing you from getting to or using the toilet, neurological and musculoskeletal conditions such as multiple sclerosis and arthritis, other health conditions like diabetes, stroke, heart conditions, breathing conditions, and prostate problems, and even some medications. As we saw in the previous slide, there are many risk factors for incontinence. So how do you know when or if you should seek help? On this slide is a bladder and bowel questionnaire. Ask yourself these questions, and if you answer yes to most or any of these questions, you should speak to your doctor about these concerns. So who do you go see if you have urinary incontinence issues? You can go see your family practice physician, a nurse, an internist, a gynecologist, a urologist, or a urogynecologist. When you make an appointment with these healthcare physicians, they will ask you about your symptoms, such as patterns of urination or leakage, how often you go, if there are any accidental leaks, an urge you might feel, or if you were coughing, lifting, or putting any other stress on your bladder when this happened. They may even ask for a history of your childbirth, pelvic operations, or medications. Your healthcare provider may also run a few tests just to make sure they know where the problem is coming from. So we know there are many risk factors, and we know when to go see people for help and who to go see for help, but is there anything we can do to keep urinary incontinence from possibly happening? Here are some things that we can do to help prevent urinary incontinence, like drinking well, eating well, having a positive lifestyle, doing exercises for your pelvic floor, a technique called diaphragmatic breathing that we will talk about later, being active, using good toilet habits, and getting help when you need the help, before it's too late. Here are some nutrition tips that you can take with you to help prevent urinary incontinence, like avoiding carbonated and caffeinated drinks and drinking at night. Try to eat a high-fiber diet to avoid constipation, which puts added stress on your pelvic floor. Avoid alcohol. This can cause you to need to go to the bathroom more often. Avoid spicy foods. These irritate the lining of your bladder sometimes. Also avoid acidic foods like tomatoes, citrusy fruits, and tropical juices. These can bother your bladder and make you feel like you have to go as well. A normal body mass index can also help prevent urinary incontinence. Your BMI is simply a measure of body fat based on weight and height. The chart on your right can be a very handy tool when trying to calculate your body mass index. To calculate, you simply look for your weight at the top. When you find your weight, find your height to the left, then follow those two until they meet in the middle. Wherever they meet is what your BMI is. A healthy BMI will generally fall within these green boxes. BMI calculations are just a tool and is not recommended to be a final assessment of your body fat because it can be sometimes unreliable. Another prevention strategy includes doing Kegel exercises. These exercises help strengthen the pelvic floor muscles and have been shown to help manage incontinence both during and after pregnancy. Reps, frequency, and amount of rest and exercise time should be as long or as much as your healthcare provider recommends. It is typically recommended to do 3 sets of 10 repetitions of a variety of Kegel exercises every day. These are 2 diagrams of the female pelvic floor muscles. The diagram on the left shows specific musculature and the names for each muscle. We'll be looking at these muscles, not all but some, on different slides pertaining to specific exercises. The diagram on the right shows a side view of the female body, and if you'll follow this red pointer over here, these are your pelvic floor muscles, this red stripe. And this yellow part right here is your bladder. This tube that comes out from your bladder is called your urethra, and that is where you urinate from. So with this picture, we can see that the pelvic floor muscles right here, they surround your urethra right here. They also surround your vagina and your anus. So these pelvic floor muscles, when they're weak, they tend to make it harder to keep urine in the bladder. So if right here it's not pinching off well, then you're going to have some urine leak out of your urethra right there. And that's caused from just either weak muscles or a poor signal coming from the brain telling your muscles to squeeze really hard right here. Now we're going to look at some specific pelvic muscle exercises that we can use in order to strengthen our pelvic floor muscles so that we don't have any leakage. This one is your transverse abdominis exercise. So here we have the video for our transverse abdominis exercise. First, you want to put a towel underneath your knees so that they're slightly bent, lay back in a comfortable position, and pull your stomach towards the floor and hold for 3 to 5 seconds. So you can see she's engaging her abdominals and pulling them towards the floor. Repeat this exercise a few more times. Make sure to talk to your physician about repetition and the length of this exercise. Next, we have the adductor therapeutic exercise. To begin with this exercise, you want to sit in a chair comfortably. Place a small rolled up towel between your knees. Gently squeeze the towel between your knees for a count between 3 and 10 seconds. Then relax for 10 more seconds. Repeat this exercise about 10 times. Once again, reps, frequency, and amount of rest and exercise time should be consulted by a physician. Squeeze the towel between 3 and 10 seconds and relax for 10 more seconds. This next exercise is called the obturator internis abductor. You also want to begin this exercise sitting in a chair. Secure a TheraBand around your thighs just above your knees. You can also use something else like pantyhose tied together in order to get the effect of a TheraBand. You want to gently separate your knees with your feet in place flat on the floor for the count of 3 to 10 seconds. Then relax for 10 seconds. Repeat the exercise a few more times. Again, you need to consult with a physician when it comes to knowing how many reps, the frequency, and the amount of rest time and exercise time. The next exercise is called pelvic floor activation therapeutic exercises. This exercise seems to be very simple, but it can do quite a bit for you. You want to begin standing with your feet shoulder width apart and toes rotated outward slightly. You can see here. Slightly bend your knees and stay in this position for 3 to 10 seconds. Then rest for 10 seconds. Remember to consult your physician for reps, amount of exercise time, rest time, and frequency. Slightly bend your knees and stay here for 3 to 10 seconds. Rest for 10 seconds. These are gluteal exercises, and we don't have a video because it's kind of hard to see. All you do is lay on your back. You're going to squeeze your buttocks together and hold for 3 to 5 seconds. Repeat this exercise 10 times, and don't forget to consult your physician. These abdominal exercises are like crunches. Begin by laying down and placing a pillow or rolled up towel under your knees so they are flexed, as you did in the first exercise. Cross your arms across your chest. Lift your head and shoulders off of the floor smoothly. Hold briefly, then slowly lower and return to starting position. Repeat this exercise as tolerated. Once again, ask your physician about the amount of reps, frequency, rest time, and exercise time that you might need for these exercises. The last video that we have to show you today is over diaphragmatic breathing. This helps strengthen your core muscles and helps you relax and distribute oxygen through the entire body. This can help lead to better continence. You may do this exercise sitting or lying down. Begin by placing your hands on your stomach. This can help you see and feel when you're inhaling and exhaling. Inhale and allow your stomach to rise. Emphasize the slow inhale and keep awareness towards your breath. Count to 5 between breaths. Exhale slowly. And you can also utilize forced breathing through pursed lips or coughing. Inhale. Exhale. Next, we're going to show you a few more examples of the prevention strategies we have for urinary incontinence. This one is exercise, and it is a little bit different from the videos we just showed you. You should do about 30 to 60 minutes of moderate intense exercise 5 times a week. This is recommended by the American College of Sports Medicine. You can do walking or yoga or abdominal exercises or running for 30 to 60 minutes every day to get these exercise requirements. Next, we're going to go into some toileting habits, and these habits may seem to help prevent urinary incontinence a little better just because it is specifically targeted at urination. First, you can use the technique of double voiding. This involves urinating at one time, then waiting a little bit, and then going to the bathroom again. You can also implement a toileting schedule. You can use your cell phone, or you can use a journal or a day planner. And this just when you set times throughout the day that you're going to go to the bathroom. So, for example, you can set times to go to the bathroom when you wake up at 6, and then go 2 hours later at 8, then 2 hours later at 10, 12, 2, and so on throughout the day. You can set a reminder on your phone or a watch or a clock that may help to remind you to go to the bathroom. You can also use this schedule as more of a diary as well, and you can write down what happened, or if you leaked, you can write down what time you leaked or how much you did go to the bathroom. This is just a huge opportunity to have written down things that your doctor might be interested in or that you might be interested in. You can also delay toileting. So, this is whenever you have an urge to go, wait to go until you've reached that 2 hour mark we talked about in the toileting schedule. This helps you learn to control when you have to go to the bathroom. Also, when you go to the bathroom, you can have a stool or a book or a trash can underneath your feet to allow for your pelvis to be put in a better position and for gravity to assist you better. You don't need a whole bunch of foot elevation in order for this to work, but slight elevation can help you greatly. This is an example of a toileting bladder diary. You can see that you can add drinks on there and how much you've drank. You can write down the trips you've made to the bathroom, see if you've had an urge to go to the bathroom, and what you were doing during the time that you had the urge to go to the bathroom. This can be helpful if your physician needs more information to better diagnose what's happening. It can also be good for you to see where you're consistent and where you're inconsistent in these things and plan your days accordingly. This specific diary is provided by the National Institute of Diabetes and Digestive and Kidney Diseases, and there's a link on the bottom right hand side of the page if you would like to go there. And lastly but not least, we have the prognosis for urinary incontinence. Prognosis just means what generally happens in people with incontinence. Strengthening your pelvic muscles does take time. So when you're doing these exercises every day, it's not going to change overnight. Just remember that you need to do these exercises every single day so that in 2, 3, 4 months, you're actually making a difference in your urinary incontinence. Most clients who do the appropriate interventions as given to them by their physicians or therapists or whoever they have seen start seeing results between 2 and 3 weeks, and full recovery is typically not seen before 3 months. You can fully recover if you're willing to do the appropriate interventions and exercises that your physicians and other healthcare providers recommend. These are the references that we used for our presentation. We thank you so much for sitting and listening to us talk about incontinence. We hope that it provided you with some great information and some good resources to go to and use if you are struggling with this or if you just want to prevent this from occurring. Have a great day.